to thank the organizing committee to invite me speaking here. Today, I'd like to talk how to procedurally diagnose dry eye. This is my financial disclosure. As you know, dry eye is a complex disease with diverse clinical presentations. We know for any disease, the scientific and process diagnosis is essential for selecting an acute treatment plan. So how to process diagnose dry eye? We have 5 key questions to answer. It including the ECT dry eye, what is the cause? What type of dry eye is it? What is the severity of the dry eye? What is the pathogenic mechanism of dry eye? Basically, we need carefully ask the symptoms and medical history. This kind of ask can help us to understand more details of the dry eye patient situation. Also, the basic examination is important. The visually is the cylinder lamp, which can definition of dry eye with another ocular surface disease. And also, we need to check the BOT. It means the tear film stability on the ocular surface. And ocular surface damage examination. This examination including the fluorescence staining, nose bank staining, etc. And in the last basic examination, including the tear volume, usually human test. Also, you can use the anterior segment OCT. With the basic and questionnaire and the medical history understanding, and plus the basic examination, then we can answer the question, is it is dry? This is the diagnostic criteria for dry in China. This criteria including the symptom and the signs. The signs including the BOT, human test, and the fluorescence staining. So this is quite simple for diagnosis of dry. But for this kind of basic examination, we also answer the question, what is the severity of the dry eye? Usually, we use the cornea staining and the BOT to confirm the different severity of dry eye. This is a PPT show the criteria of the 3 kind of severity of dry eye for mild, moderate, severe. But this is not enough for the process of diagnose dry eye. We know the dry eye is multiple factors. This cause can classify into 7 types. It including the systemic factors, ocular factors, environmental factors, and the lifestyle-related factor, and the surgical-related factors, medication-related factors, and other factors. So we need to give a diagnosis and analysis what is the cause of dry eye. And for the classification of dry eye, and we can base the tear film structure and function and to classify dry eye into 5 types. The aqueous deficiency dry eye, lipid deficiency dry eye, mucus abnormal dry eye, and the tear film dynamic abnormal dry eye, mixed the type dry eye. Of course, in clinically, the evaluate the type of the dry eye. So we need to another examination. The examination including we evaluate the eyelid and also mecanogram morphology, and this is a variant can help us to differentiate if the patient is from the MGD or another MGD related in the dry eye. Also, we need to do another and special examination, including the ocular surface analysis and the corneal topography, and also analysis lip layer thickness and morphology. The We can use the corneal confocal microscope to check the changes in cell level and also to check changes. Thank you, Chairman. Firstly, I'd like to take this opportunity to thank the organizing committee, including the fluorescence staining, nose-based, local factors, environmental factors, and the lifestyle-related factor, and the surgical-related factors. Thank you, Chairman. Firstly, I'd like to take this opportunity to thank the organizing committee to invite me to speak here. Today, I'd like to talk how to. This is a diagnostic criteria for dry in China. This criteria. Thank you, Chairman. Firstly, I'd like to film the theory for dry in China. This criteria including the symptom and the science. The science including the BOT, Schumann test, and the fluorescence staining. So this is quite simple for diagnosis of dry. But for this kind of basic examination, we also answer the question, what is the severity of the dry? Usually, we use the corneal staining and the BOT to confirm the different severity of the dry. This is a PPT show the criteria of the three kind of severity of dry for mild, moderate, severe. But this is not enough for the process of diagnose dry. We know the dry is multiple factors. This cause can classify into 7 types, including the systemic factors, local factors, environmental factors, and the lifestyle-related factor, and the surgical-related factors, medication-related factors, and another factor. We've answered all of the 4 types of the recently, we find another mark in tears, the name of the OTA. And we know the OTA is a kind of protein and replace of the immune and the homeostasis of the ocular surface. So this is the marker is very important for the immune situation for the ocular surface and the microenvironment. We want to know is OTA is the effective to the diagnosis of the dry and also to tell us the pathogenesis of the dry. So we totally have the 1,623 cases was screened with the 1,168 cases effectively enrolled in our study. Among them, the more than 800 cases in the dry group and 390 cases in the no dry group. The result shows in dry group, the OTA concentration is 0.64, and the normal control group 2.05. So the result tell us the OTA concentration in the dry group was significantly low than that in the control group. And the result also shows the tear film OTA concentration shows a significant negative correlate with the dry questionnaire scale, conjunctival hyperoma, and the corneal staining. And it also shows a significant positive correlate with the Schumann test and the TBOT. In the last study, the professor then showed that there is a synchronous positive correlation between global cell density and the OTA concentration, and also is a positive correlation between the OTA concentration and the BOT. So this result tell us there is a strong positive correlation between the OTA concentration and the conjunctive global cell density. And also, the OTA has a center value in assist tear film stability and the diagnosis drive. So this is a study tell us the OTA test can tell us is this mucin deficient dry, and then is there on overactive T cell immune state and can provide guidance or medical direction, and also observe efficacy through changes in LTA levels. So in summary, scientific and process diagnosis of dry is the foundation of achieve the targeted treatment. So detailed and thorough inquiry into symptom and the medical history, along with standardized basic examination, are critical. And the emergence of the various new diagnostic instruments and the method has enhanced the in-depth understanding of dry eye. So diagnosis of the underlying mechanisms provides direction for treatment. Thank you very much for your attention.